old-timey thing was, if you swallow a poison, try to make a person vomit or make them have diarrhea to get rid of it. But that's not really the way it should be. Stay with us when we talk about what you should do if you think you've been poisoned.
Kentucky Health addresses the healthcare concerns of all residents of Kentucky and surrounding states. It was created by Dr. Wayne Tuckson, a colorectal surgeon practicing in Louisville. Here is your host, Dr. Wayne Tuckson.
Hi, and welcome to another segment of Kentucky Health. Today we want to talk about poison. Now, this is going to be a rather broad subject, talking about things that can poison you in normal, small amounts, things that can poison us that are normally good for us in too high amounts, and things that look alike that can poison us, things that can confuse us, and even talking about some medications that may get us into trouble if we use them inappropriately. With us today, we have two guests from the Kentucky Regional Poison Control Center of Kosare Children's Hospital. We have Ms. Brooke Wilson, thank you very much for being here, who is the Public Education Coordinator, and Mr. Henry Spiller, who's the Director. Thank you for being with us. And again, thank you for being with us again. I know you were here a couple of years back. So let's talk about things. Brooke, tell me, what is the Kentucky Regional Poison Control Center?
Well, we are a telephone hotline. We are there for emergency services, number one. Number two, we're there for education purposes. So with any poisoning emergency or just simply question you have, you can call 24 hours a day, 7 days a week, and an expert, a nurse or a doctor, will answer your phone call immediately and continue following up with your case if necessary and provide treatment, and if need be, a hospital visit, or they will decide the treatment plan as they talk to you and get more details.
We're going to give this several times during the show, but how do they call you?
They call 1-800-222-1222.
I'm sure there's a jingle that goes with that, but I have a feeling we're not going to hear it. Henry, yes. So how does this whole thing work? I mean, is this something that's just for Louisville? Is it just for Kentucky, or how's the whole setup?
Our center takes care of the entire state of Kentucky, all 120 counties. We end up taking care of a number of the southern Indiana counties because they consider themselves Metro Louisville, and we're here in Louisville. The Poison Center manages, last year was 50,000 cases. It's about 135, 140 a day, every day, 365 days a year. We get anywhere from very young children exploring their world, to adolescents, to older adults, and everything in between. What they get into changes based on the different age groups, but each one ends up needing the Poison Center.
Well, what is the difference? Because that's a good point. Do you find that what the toddlers get into is different from the young children versus the teenager versus the young adults and older patients?
Yes, very much so. The toddlers are exploring their world. It's their job to kind of go out and kind of learn. So they touch, they pick up, and then they taste. And that's how they learn. Unfortunately, they do this with things they perhaps shouldn't. Things that are colorful, things they've seen their parents use, things that are in the kitchen, things that are in the bathroom, things that are in the house. And they get into any number of things. This is, we get toddlers on farms, in the barn, in the garage, with their father's auto products. There's all sorts of things they get into. It can be really varied. And in some cases very dangerous, in some cases very benign.
What about on the other end of the age spectrum then, the older patient?
The older patients we tend to see, they get into lots of things. Medications are a big issue with older patients, especially as they hit the 40s, 50s, 60s. Most of this population is on some form of medication, and we get a lot of medication errors. We recently completed a study where we saw almost a 5-fold increase in insulin errors in this population. And because it's specific to insulin, they use two different types of insulin. They use one type in the morning when they're going to have meals and activity, and they use a different type of insulin in the evening when they're going to go to sleep, and they mix these up. And the problem is at 6, 7, 8, 9 o'clock at night, their doctor's office is closed. You know, anyone they're going to check with is closed. However, the poison center's there, again, 24/7. They get a nurse or physician immediately.
Okay.
So with the older adults, they also mix, unfortunately, cleaning products. We get a lot of biological snake bites, flying insect stings, all sorts of things. It varies what they'll get into, often even with the season.
I think we'll come back to that point. But Brooke, since we talked about these toddlers running around exploring their universe, do you recommend, or are there any things that we should do to try to minimize the exposure of these young people?
Oh,
to
absolutely. For example, some medicines, they have to claim to have child-proof tops, but nothing's really child-proof. It's more child-resistant. It'll slow them down, but not necessarily stop them. So just make sure all dangerous cleaning products, everything that is not a food, be kept up in a locked cabinet away from the reach of a toddler. Specifically, Rick always jokes, well, not jokes, but he says that half of our calls could be eliminated if people would switch out their canned goods underneath the sink and move everything from underneath the sink up into the cupboards, because that's at eye level for children. And you know, it's pretty, it's a fun color, and they just want to try it out. So making sure to keep all that away from kids. Same goes for mom or grandma's purse. A lot of times medications will be in there, toddlers will get into it, just making sure everything that could be dangerous is up and out of their reach.
Grandparents get into, they were great parents, but they're not used to small children anymore. It's been 20 years since they had the 2-year-old running around the house, or 25 years, you know, and now they're back. But now they're in a different stage of life. They have more medications they're on, there's other things, and they often put their medications on the kitchen counter to remember to take them. Like, I got to remember to take my pills every day. And they're out there right at eye level of children. They're often, we have a number of overdoses in young children because they're playing in grandma's purse.
Yeah.
They get into, you know, grandmother's got her medications. We brought a number of lookalikes to kind of go through.
I was fascinated by this.
And
Now, tell me about this. Now, we're not denigrating any particular product. We're not talking about it. It's just merely because of the color similarities.
Right. Well, if you're a toddler, you don't read yet because you don't learn to read till you're in school. So preschool children can't read yet. But they, you know, if you look at these, syrup looks just like motor oil. One's going to be very dangerous, and one's a food product. When you're 2, you don't know the difference. They both look very colorful. They both look the same. You're going to take a mouthful or two. I remember this tasted really good on my pancakes. I would like a little more.
So, but what is the problem? So, okay, so someone takes in a bit of the motor oil. What's going to be the big issue here?
With that particular one, we're concerned if it gets into the lungs, aspiration. If they swallow it and it goes to the stomach, it's relatively benign. It just causes a little stomach upset. But if it goes into the lungs, it causes what's called pneumonitis, or it collapses the lungs, and the children can't breathe. It takes away the surfactant, and the lungs essentially collapse. And we have, if they get it into the lungs, they'll often be put on a ventilator. We may have to go in. It's a life-threatening situation.
How do I know this has gotten into my child's lungs?
Initially, we're going to, this is one of the few where we've got sort of a yes or a no, a black or a white. You know, if it went to the stomach, it's going to be relatively benign. If it went to the lungs, we're going to start to see coughing, breathing difficulty, but coughing and choking are the kind of the easy ones for the parent to kind of see. You know, we'll listen to the lungs. There's a number of other things we could do, chest x-rays, other things, but the mom's going to look at the child and he's going to kind of and can't breathe and sort of have a persistent cough, like he'll be in distress.
So tell me, Brooke, the kid has swallowed this. I pick up the phone and now, what's that number again?
1-800-222-1222.
And what happens at that point?
A nurse or a physician will pick up immediately, and they will want to know what has happened, what product was involved, who was poisoned. They're going to get as many details as possible, and then they're going to proceed to decide if this is something that needs to be seen. You need to go to the emergency room, if you need to go to the doctor, or is this something that they can treat you over the phone at home? So with the case of the motor oil, like Rick was saying, if they assess that it went to the stomach, the child is not in any distress, they're going to treat you over the phone and tell the parent exactly what they need to do. And they're going to continue to follow up with the patient over the course of the next day.
Oh, you guys will initiate another phone call?
Yeah, we will continue to follow up.
For hydrocarbons, we follow them for 72 hours. We'll follow up. Well, here's a
Okay, water, alcohol, rubbing alcohol, and paint thinner.
The problem is, again, when you're a toddler, they all look the same. And it doesn't take much. The paint thinner, again, is a hydrocarbon. It's going to be one mouthful, as little as what we call 3 milliliters, or a half a teaspoon.
So just that amount to find out that yuck still enough.
If it went to the lungs, that's enough.
Okay,
I mean, it's very little. And rubbing alcohol, this is 70%. And so, again, it doesn't take much when you only weigh 35 pounds or 40 pounds. It's the, it's the small body weights of these toddlers that comes along with their exploratory behavior. They're also very little.
Yes.
And it doesn't take a lot. That's one of the issues, is that they're very small.
So what is going to be the problem that you find immediately with a person with isopropyl alcohol, say as opposed to ethanol?
Isopropyl is about roughly 2 times as potent as ethyl alcohol. It produces the same effects, drowsiness, coma, what we call CNS depression, but it goes through, ultimately you can get breathing, respiratory depression, your respiration slow down. Depends on the level. It's pretty much like being drunk. It just takes not much. And instead of, say whiskey is 40% ethanol, this is 70% isopropyl. You would have to have 4 shots of whiskey to equal 1 shot of isopropyl. Again, we're talking little guys.
So the potential for liver injury and other things is very great here.
It is. Depends on how much they get. But this is something that, it's found around the house when you're 2. You could be exploring.
Now, 3 things that strike me very interesting. And Windex, or any kind of window cleaner, tends to have this blue color. This alone will probably kill a kid anyway, the sugary drink, okay? And then you have mouthwash. They all look alike, so what's the difference?
Well, this one, it may be given to the child or an older sibling by the parents, or something like it. We just brought this particular brand.
Yes.
But, so they recognize it. They're like, oh yeah, that stuff's great, it's Kool-Aid, I love that stuff.
Of course, you're referring to the generic Kool-Aid, not necessarily
I'm sorry,
the brand.
yes, the generic
Okay.
Kool-Aid.
I would not want some large picture coming in
they
there.
may think of that blue, juice,
Yes.
Whatever in their mind, and then they see the mouthwash. Their parents may use this in the bathroom. They may not know that the parents spit it out, but they see the parents take a mouthful of it, put it down. They may not remember that the parents are spitting it out, and so they see the blue flavor. And the mouthwash is palatable. It's sweet. It's meant to be, kind of swished around the mouth. So this has 25% ethanol. It's roughly equivalent to whiskey, which is 40%. But I mean, a couple of ounces of this, 3 ounces of this in a toddler will put them in a coma.
Wow.
It's not a lot. I mean, it's more than a mouthful. It's more than a taste. But if they think it's something that they want to drink and they drink down half that bottle, we're in trouble.
What about the ammonia containing products?
This one's probably just going to make them vomit. What's in here? There's something called glycol ethers, where if they drank the whole thing, we'd be concerned. But it's probably going to they're going to be vomiting.
What about the antifreeze? Because it has a bluish color sometimes, and it's sweet.
Well, there's two main colors of antifreeze. One's this like lime green color. that looks just like Mountain Dew. That one frightens us a little bit. We did have there is a pink one that we actually had someone mistake for a cranberry juice cocktail. It's sweet as well. You know,
Really?
it's one of those where, again, it kind of depends, you know, what's around the house. When you're 2, you don't know that it's not what we think.
Let's shift gears just a little bit, if we may. I know you talked about incidental poisonings here. Let's talk about something a little more intentional. People out here nowadays are using cough syrups as a means for recreational pharmaceutical enhancement to get high on.
It's very large in the adolescent and young adult group. They'll use the liquids like this. They'll also use pills. Chlorocidin is a big one that they use. It's something that they start to learn about in late middle school or high school and carry through adulthood. It's over the counter. There isn't a whole lot of suspicion when you go into a drugstore, I was going to say Walgreens or CVS or any one of the local drugstores, and pick up a box of this. You know, it's over the counter.
But as a parent, what am I looking for? Or as a friend, what am I looking for if I think A, the person is doing that, or B, they're getting into trouble?
Well, you can note during the use of it, you know, you'll see they're very drowsy, kind of stumbling. You know, you'll see a real change in behavior. If they're doing it away from the home and trying to mask it, you know, our concern is that you'll see either empty bottles, empty boxes that you didn't purchase, maybe thrown in the trash can under something. But if you see extra boxes of these and you didn't purchase them, that would be a strong suspicion in my part.
What can this cause? What kind of problems can you get from this stuff?
There's two real problems. One, they affect the brain, CNS, and the other one, they affect the heart and blood pressure. So when they take very large, there's a third one I get to, the liver. But if they take too much, they can either get very drowsy, comatose. We do see seizures when they think if 2's good, 4's better, 8's even better, and they get over that threshold where they just kind of walk themselves into real danger. And so we've seen them where they get agitated, hallucinating, even seizures. It also affects your heart rate and blood pressure. You get tachycardia. We've seen dysrhythmias, especially in the summer heat. Where they abuse it, they can get into heat stroke and collapse. And then the final one is one of the ingredients in these that is great if you have a cold is the Tylenol portion of it. You know, it brings down your fever, gets rid of your aches. It doesn't really add to their high, but it's in there.
Okay.
And when they start to take 8, 10, 12 of these for the other drugs that are in there, you can get a Tylenol overdose. And Tylenol overdose it has, for about 24 hours, it doesn't have any effects. It doesn't look like it has any effects. It's killing the liver, and what you see at 24 hours is when they're in liver failure. And so it has this delay. It's still occurring. It's still just as dangerous. You just don't see it in the first few hours. You see it in the later hours after the liver's already failed. So it's one of those where we're really concerned because it's not part of their intent, but it's one of the dangers that they face.
Brooke, let me ask you. So I can pick up the phone and call you, but suppose I'm out in the woods and we're sitting around, we decided to forage around, we found some mushrooms and things like that, and we decided to cook them and eat them.
Don't
What
do
can we
that.
do? Okay, don't do it.
If you do not, if it is just a wild growing mushroom,
Yeah.
do not.
But suppose somebody ate something and suddenly they have a belly ache or they're acting a little goofy.
I would find a phone.
Okay.
I would absolutely.
But I can't describe this to you, can I? Would you want me to describe to you what the mushroom and everything look like? Any other techniques
if
you have?
anyone happens to have a cell phone on them, we actually have the technology where you can take a picture with your phone and you can email it to us. And that helps us identify what you're talking about. So if you say, I ate a mushroom, I thought it was okay, I'm feeling sick, you can call the Poison Center, and they might ask you, please take a picture, send it to us, and they'll talk with you while they look at the picture and identify what it is in their database.
Interesting. Does that work for
It
critters
works for
and
anything.
things like that
it
too?
works. You can
Works
if
great
you-
for plants.
Works great
when
for
the little
plants.
toddlers out there,
Is it poison
especially out
ivy?
there,
Take a picture.
outside, looking at the shrubbery, sees the red berries, looking at something that's shot up out of the ground, a great little
Yeah.
pretty something. Who knows what it is? Parents don't know what it is, but we're pretty sure that the child ate it.
Take a picture.
We've recently, it's great because trying to identify a plant because, well, it's got green leaves. We're a lot of plants have green leaves. It's got red berries. We're like, well, we're down a little, but it's still kind of hard to identify with those descriptions. But the picture lets us narrow in on a very, very rapidly.
And the picture can also help with the mounts. Say your child got into some kind of liquid. You don't know what it is. Well, the nurse on the phone is going to know how much did they get into. Well, I don't know. If you can take a picture, it might help them gauge
see.
better how much they actually took, how much was spilled, that sort of thing.
So nowadays, should we use activated charcoal or induced vomiting or anything like that after ingesting of a potential toxin?
We don't use Ipecac. That's the old medicine to make them vomit when you open. We don't use that anymore. We do use activated charcoal. Activated charcoal we have to use in the first hour after they ingest it. So in some cases we will use it at home because it's just happened. Activated charcoal acts by binding the substance to the charcoal. It's like a magnet. Kind of attaches, and it's indigestible, so it comes out in the feces unchanged, like you just poop it through, but it binds it like a magnet and takes it through. And so if it can get it in that first hour in the stomach, it never gets absorbed. It's just takes the trip, as we call it, and comes out, and you get a black stool about
there you go.
a few hours later. But attached to that black stool is all the whatever it is, the drug or the plant or whatever you ate. It's coming out with that.
Right, and we advise that all parents just have it at home. You can go to your local pharmacy and ask the pharmacist about activated charcoal. Just keep it up out of the reach of kids, and if you do happen to need it, it'll be there, and you can get it to your child with
What about if I want to have some information about potential poisons and things that we should do? Is there a way to get that information?
Yes, you can call the main number, 1-800-222-1222, and you can just tell them that you would like to speak to the educator, me, and I can provide whatever kind of information you need. We have brochures,
You have a website?
magnet stickers, we have a website, we have educational programs, and
What is that website?
www.krpc.com.
And what's there? If I have information about things that we can do and
Right,
programs?
there's a public education section, so there's resources on there for parents, there's resources for teachers and children. We have a more professional education section on there. And
Just for physicians, nurses, and pharmacists. They can get CEUs and CMEs and CEs, depending on their particular professional board.
But for churches and things, they can have that information there, so have available.
you can always check our website. They can always give us a call anytime just for information.
And if they're having some sort of fair, they can order, it's free, by the way, but they can order things for distribution, refrigerator magnets, pamphlets, information resources that we have. Brooke will send them out.
Well, I think clearly this is one of these instances where prevention is far better than the cure is ever going to be. I think points that Brooke raised, but I think it was good. Put the canned goods down, put all the other things up on high, and use common sense. Let's just keep these toxic materials out of the way of kids and watch out for our medicinals. Keep those out of the way and perhaps we'll lock those things up for ourselves. More importantly, if you have a question about something that you have taken, family member, or especially one of the kids, you want to call the Poison Control Center at
1-800-222-1222.
I got to tell you, folks, earlier there was a great rendition of the jingle, but I have a feeling we're not going to have a chance.
We're going to have
here.
one? Come on, Brooke.
If you have a chance, if you want any more information, feel free to call the Kentucky Regional Poison Control Center of Kosare Children's Hospital. Ask for Brooke Wilson or for Henry Spiller. I'm sure they'll be more than happy to hear you, and perhaps you'll get lucky enough to hear that jingle. Thank you for being with us in this segment of Kentucky Health. Thank you both for being here.
Thank you very
and
much.
Please
Oh,
watch
here's
out.
another.
Watch out for
Here's
the
a
lookalikes. Thank you
Parmesan.
very much.